Welcome everyone to our NCLEX learning series. Each day, we will be uploading 2 to 3 important topics, along with multiple choice questions to help you practice and strengthen your preparation. So make sure you stay connected with us daily and do not miss any session. In today's lesson, we are going to focus on a very high-yield concept for your exams, which is Maslow's hierarchy of needs theory. This topic is not only essential for nursing practice, but also forms the foundation of NCLEX prioritization questions. So let us dive right in and get started. Before we continue, let me quickly share why our NCLEX crash course is truly the ultimate shortcut to success. This program is powered by the real experiences of more than 5,000 students who have already passed their NCLEX using these exact strategies. It has been carefully designed as a fast-track system to save you valuable time, boost your confidence, and guarantee exam readiness. Inside this course, you will get 100 hours of animated crash classes that make last-minute review simple and visual, along with over 500 hours of recorded lectures that explain every NCLEX topic in detail. To make sure you never get stuck, we also provide daily live classes where you can interact with experts and clear your doubts instantly. On top of that, you will practice with 5,000 previously asked NCLEX questions for authentic exam-style preparation, and you will take 15 full-length mock tests in CAT format, so you train exactly the way the real exam is tested. We also include an NCLEX ebook to help with focused quick revision and give you 1 full year of access so that you can study at your own pace, anytime and anywhere. Right now, we are offering a limited-time 70% discount, but this offer will only last for a very short period. So, do not wait, take action now, join today, and secure your NCLEX success before it is gone. To enroll, simply visit our website. Link is also provided in the description box. Let us begin by understanding why Maslow's theory is so important in nursing and the NCLEX. Maslow's hierarchy of needs is a psychological framework that helps us prioritize human needs from the most basic to the most advanced. For nurses, this theory is not just theoretical. It is a clinical decision-making tool that guides us in determining which patient problem takes priority. On the NCLEX, it is often used to decide which patient to see first or which intervention to perform before others. Maslow's model is usually represented as a pyramid with 5 levels of needs. At the very bottom of Maslow's pyramid are physiological needs, which are essential for human survival. These include oxygen, airway patency, breathing, circulation, nutrition, fluids, elimination, shelter, rest, and temperature regulation. In nursing, this means if your patient cannot breathe, nothing else matters until the airway and oxygenation are addressed. For example, between a patient who is short of breath and another who is anxious about discharge, the patient with respiratory distress takes priority. NCLEX tip. Always check whether the problem falls under airway, breathing, circulation, ABCS. These align directly with Maslow's first level. The second level is safety and security needs. Once physiological stability is achieved, the next priority is safety. This includes both physical safety like preventing falls, controlling infection, and administering medications safely, and psychological safety, reducing anxiety, ensuring emotional security. For example, imagine a confused elderly patient at risk of falling versus a patient complaining of loneliness. The NCLEX answer is the fall risk, because safety outweighs emotional needs. Clinical scenario: if a psychiatric patient expresses vague suicidal thoughts while another patient has low-grade fever, which comes first? Safety is a top priority, so the suicidal patient must be assessed immediately, since it is a threat to life. The third level is love and belonging needs. The third level focuses on emotional connection. Love, friendship, belonging, family, and community. As humans, we need acceptance and support systems. In nursing, this can mean encouraging family involvement, supporting group therapy, or reducing feelings of isolation. But on NCLEX, remember, love and belonging are never urgent if physiological or safety needs are compromised. For example, answering a patient's call light to relieve dyspnea comes before arranging a family phone call. At the fourth level, humans seek esteem, respect, independence, and recognition. Nurses foster this by promoting independence, offering praise, and giving patients choices in their care. For example, allowing a stroke survivor to practice dressing themselves, even if it takes longer, helps rebuild self-confidence and dignity. This level is important for long-term recovery, but it never outweighs immediate life-saving needs. At the top of the pyramid is self-actualization, which means reaching one's full potential. Patients at this stage may set new goals, seek creative outlets, or pursue personal growth despite illness. Nurses encourage this by providing opportunities for self-expression and purpose. For example, a cancer survivor starting a support group for others is demonstrating self-actualization. In nursing care, this is the ultimate goal once lower levels are met. Now, let us connect Maslow's hierarchy directly to NCLEX test strategy. When faced with multiple patient care scenarios, always address lower-level needs before higher-level ones. A patient with shortness of breath will always come before a patient who feels lonely. A fall risk must be managed before a patient's request for extra pillows. And remember, physiological and safety needs are usually urgent, while love, esteem, and self-actualization are important but never immediate priorities. Let us begin with a classic prioritization question. Imagine you walk into a ward where 4 patients are calling for assistance. Who do you go to first? Option A, a patient requesting extra blankets because they feel cold. Option B, a patient complaining of shortness of breath and chest pain. Option C, a patient feeling lonely and requesting to call their spouse. Option D, a patient asking for help repositioning due to back pain. The correct answer is option B, the patient with shortness of breath and chest pain. According to Maslow's hierarchy, physiological survival, airway, breathing, and circulation always comes first. Extra blankets, emotional needs, or comfort measures can wait. This is a key NCLEX prioritization principle. Airway over everything else. Question 2. Here is another question. Which nursing action best reflects addressing a patient's safety needs? Option A, encouraging the patient to join a cancer support group. Option B, assisting the patient with ambulation using a gait belt. Option C, praising the patient for independently bathing. Option D, providing extra snacks between meals. The correct answer is option B, assisting with ambulation using a gait belt. This prevents falls and ensures physical safety. Joining a support group is love and belonging, praising is esteem, and snacks are physiological. So the key takeaway: safety comes immediately after basic survival. Question 3. Now think about this. A patient recovering from a stroke insists on feeding themselves even though it takes longer. Supporting this behavior addresses which level of Maslow's hierarchy? Option A, physiological. Option B, safety. Option C, esteem. Option D, self-actualization. The right answer is option C, esteem. By letting the patient feed themselves, you support independence, dignity, and self-respect. While eating is physiological, the emphasis here is not on survival, but on self-confidence. Always watch for the subtle NCLEX twist. Question 4. Here is a higher-level example. A terminally ill patient says, "I want to spend the rest of my time writing poetry." Which Maslow level does this represent? Option A, safety. Option B, love and belonging. Option C, esteem. Option D, self-actualization. The correct answer is option D, self-actualization. Writing poetry for personal fulfillment reflects the highest level of growth. They are no longer focusing on survival or safety, but on reaching their full potential. Question 5. Now let us prioritize again. Which situation should be addressed first? Option A, a patient with a new tracheostomy who is coughing and unable to clear secretions. Option B, a patient who is crying because family has not visited. Option C, a patient requesting help with toileting. Option D, a patient upset about missing their favorite television program. The correct answer is option A, the patient with a new tracheostomy and airway obstruction. Airway patency is the most urgent physiological need. Family issues, toileting, or emotional comfort can only be managed after the airway is secure. Question 6. Now let us talk about a pediatric case. Which intervention best addresses love and belonging needs for a hospitalized child? Option A, administering intravenous fluids. Option B, allowing parents to stay overnight. Option C, teaching hand washing. Option D, praising the child for eating food. The correct answer is option B, allowing parents to stay overnight. Family support and emotional connection fulfill love and belonging needs. Intravenous fluids are physiological, hand washing is safety, and praise is esteem. Question 7. Here is another question. A patient expresses fear about being discharged home alone after surgery. This reflects which Maslow level? Option A, physiological. Option B, safety. Option C, love and belonging. Option D, self-actualization. The correct answer is option B, safety. The patient is not worried about oxygen or nutrition, but about security and stability at home. This is a safety concern, not an emotional or higher level need. Question 8. Now imagine you are prioritizing patients. Which situation is most urgent? Option A, a patient at risk of falling when getting out of bed. Option B, a patient who has not eaten for 24 hours and is weak. Option C, a patient reporting severe loneliness. Option D, a patient who is angry about delayed discharge. The correct answer is option B, the patient who has not eaten for 24 hours. Nutrition is a physiological need and takes priority over safety or emotional needs. A fall risk is important but potential, whereas starvation is an actual physiological problem. Question 9. Let us consider this scenario. A nurse encourages a patient with diabetes to attend a teaching class about diet and insulin. This represents which Maslow level? Option A, physiological. Option B, safety. Option C, esteem. Option D, self-actualization. The right answer is option D, self-actualization. Education, growth, and self-improvement are examples of patients reaching their full potential. While diabetes care involves physiology and safety, the act of learning reflects self-actualization. Question 10. Finally, let us end with a simple one. Which intervention reflects addressing a physiological need? Option A, assisting a patient to use the restroom. Option B, applying a bed alarm for a confused patient. Option C, arranging a family phone call. Option D, teaching relaxation techniques. The correct answer is option A, assisting with restroom needs. Elimination is a basic physiological requirement, and it always comes before safety, love, or psychological comfort. Thank you.